Hi, my name is Mary Schmidt. I've been in the medical field as a medical assistant for more than 15 years now. I want to talk today about handling front office duties because I've always considered the reception desk and front office duties to be the brain of the office. The front desk has a lot of duties: banking, phone, faxing, relaying messages, making sure the charts are ready and available, organizing them, and most important, confidentiality.
Okay, as a medical assistant, you are going to need to be comfortable on the telephone, dealing with patients' needs and all of their concerns.
Do you feel a little timid, a little nervous about being the first impression in the medical office? Being the person who answers the phone, calling the patients back and greeting the patients? I remember for the very first time myself when I went out in the waiting room and I called my first patient back, I was stuttering over the name. I felt like I had 50 pairs of eyes looking at me. But once you start working in the medical field, you'll feel confident, and it's rewarding, especially when patients call and ask for you by name. They know that they can trust you, and they know that you will help them resolve whatever issue it is that they're having.
I've never worked at any place that has just a designated receptionist. We have all been responsible for whoever's got an empty hand. When that phone rings, you go to the nearest handset, you pick it up, and you take that call. Whatever that patient's needs are, the medical assistant has to be able to handle all of those facets.
So in the office, there are telephone techniques that you are going to need to learn. One of the telephone techniques that I want to talk to you about is a smile. Now you may be asking me, why do you want to talk about a smile? When you answer a phone, a smile can be heard through the phone.
Put a smile in your voice and let that transmit through the phone lines to your patient. Because your patients are usually calling you because they're not happy, they're not feeling well, they've got a problem, and so that's why they're on the phone.
You can hear a smile in someone's voice. You can hear courtesy. You can't really sound courteous and helpful if you're not smiling. One of the ways to answer the phone is clearly, "Doctor's office, this is Mary, may I help you?" I don't know about you, but it really annoys me when I hear, "Doctor's office, please hold," and there's nothing afterwards. That can be a problem. The next one is actually being an active listener. Active listening to hear what it is they want, need, are concerned with. Don't ever assume that you know what it is that they're calling for. An active listener is letting your patient, the person on the other end of the phone, explain to you the reason why they're calling without interrupting, without assuming, so that you can find out everything it is that they're calling in regards to.
We're going to concern ourselves with always being the ultimate professionals for our patients.
And the next thing that I want to talk about is placing a call on hold. Sometimes in the office we feel like an octopus with the phones, 12 arms going crazy. If your phone is ringing and you answer, "Doctor's office, this is Mary, may I help you?" and suddenly another line starts to ring, what are you going to do? "Mrs. Jones, my other line is ringing. Can you hold a moment?" "Thank you very much." "Doctor's office, this is Mary, can I help you?" "Hi, Mr. Smith." "Mr. Smith, I'm sorry that you're having that problem right now. Mr. Smith, if you wouldn't mind holding a moment, since this is not an emergency, I'm helping a caller on the other line. I'll be right back with you." "Yes, it's Mary." "Okay, thank you." "Hi, Mrs. Jones. Let me schedule that appointment for you now. Thank you for holding." A lot of times this can be hard to do. You could have an office with many lines that need to be answered. Handle each one individually.
It's really important not to let your patients wait forever on a phone call because their time's important.
Most test results come by fax. Sometimes even some offices have the capability of getting them by email. But when you get test results over the phone, they're usually critical lab results. Doctor's office, this is Mary, may I help you? Yes, this is ABC Medical Labs. May I ask who I'm speaking to? Tanya. Hi Tanya, this is Mary. You're calling in lab results for our patient, Mr. John Jackson. May I have the date of birth? Yes, that is our patient. Yes, he was the ordering doctor. May I have the results? Yes, that is a critical level. I will give the doctor the results immediately. Thank you very much. A hard copy will be coming shortly. Thank you. I'm going to take this document, I'm going to pull the patient's chart, and I'm going to make sure the doctor gets it as soon as he comes out of the exam room. When I took this phone call from ABC Labs, there was a few things that I wanted to make sure of. That we were speaking about the same patient and verified the patient's date of birth. I also verified the name of the doctor who ordered the test results. The lab asked for my name to confirm who they gave this critical message to. I also in turn asked for their name. I not only ask for the name of people that I'm speaking to, but I will also put today's date and the time these results came in. This is very important. I am going to give this message to the doctor as soon as he comes out of the exam room, attached to the patient's chart. If a hospital calls or another physician calls, you always put the doctor on the phone. That means even interrupting him in an exam room. A home health care agency, home visiting nurse, a pharmacy may call. You have to be able to decide, can I just take a message that this pharmacy is asking for a prescription refill, or the home visiting nurse is just giving an update on that patient's progress? Or do they need to speak to the doctor?
Usually, anytime a doctor or a hospital calls, in particular a doctor that calls the office or an in-person visit, that's up. Just give me a moment, doctor. You're going to put him usually back in the doctor's personal office and knock on the patient room where he is and say, Dr. So-and-so is here to see you.
One of the things that's very hard to deal with is the irate caller. I want you to remember, don't ever take it personally. Callers are allowed to be cranky. They don't feel good. They're sick. They're worried. They're concerned. That's why they're seeing the doctor. So you want to handle that irate caller calmly. The best way to diffuse a situation with an irate caller is to assure them that you will help them rectify what the problem is, come to a solution, and let them know what your name is. I've said before when you've answered the phone, in doctor's office, this is Mary, may I help you? When a patient has your name, they feel as though they're definitely going to get results.
You're always wearing many hats and juggling, but that's part of what makes the job so exciting and fun. It's not boring because it's hardly ever, just dull.
Emergency phone calls are very critical in the way in which you handle them. Remember, be assured, you've been trained on how to handle emergencies. You're certified in first aid and CPR. But the phone is a little different. An example of this would be, doctor's office, this is Mary, may I help you? Mrs. Jackson, what's the matter? Mrs. Jackson, I want you to relax and calm down a moment. Give me your phone number and your address. That's in case we get disconnected. Mrs. Jackson, it would not be a good idea for you to come to the office. Doctor would prefer for you to be seen in the emergency room. Do you have someone who can take you? Mrs. Jackson, I'd like you to hang up and call 911. You're feeling short of breath? Mrs. Jackson, is your front door unlocked? I can call 911 for you. Hold on one moment. I would actually leave her on the phone while I go and get on another line and call 911. A patient could actually walk into the office. Profuse bleeding, severe vomiting and diarrhea, a high fever, telling you that they've just suffered a seizure, all possible life-threatening emergencies. You've been trained and certified in first aid and CPR. Use those lessons that you've learned to act quickly, calmly, and professionally.
Think about where you work as being a little island oasis where the other concerns don't get to invade because you're going to be working with people who have a lot of problems. Part of your job is to help them resolve some of those problems.
So if you told me you were going on your externship and starting at an office tomorrow, what kind of tips could I give you? Be on time. Look professional. Clean scrubs. Ask questions. Follow your office's policies and procedures. Listen. Write notes down for yourself. And remember, you want to treat other people exactly how you would like to be treated. With that, you have a winning plan.